In New York City, we believe everyone deserves affordable health care, no matter how much money you make or where you were born. That's why we created NYC Care. This program helps you get health care at little or no cost. NYC Care is not health insurance, so you don't have to worry about monthly payments. And it's free to join. You can join NYC Care as long as you've lived in New York City for more than 6 months, don't qualify for health insurance in New York State, and can't afford to pay for a health insurance plan. Once you join, you'll get a membership card, which allows you to visit our hospitals and neighborhood health centers across the city. You'll also get your own primary care doctor, who you can see in 2 weeks or less. Plus, you can get low-cost prescription medication with expanded hours at pharmacies nights and weekends. NYC Care also provides specialty services, such as women's and mental health, diabetes care, and cancer screenings. If you're unsure about the services we offer, a 24-hour customer service support line is available for people who speak your language. Are you ready to unlock your right to healthcare with dignity and respect? Visit our website or call us to get started today.
En la ciudad de Nueva York, creemos que todos merecen atención médica a bajo costo, sin importar cuánto dinero gane o dónde nació. Por eso creamos NYC Care. Este programa lo ayuda a obtener atención médica gratis o a bajo costo. NYC Care no es un seguro médico, por lo que no debe preocuparse por pagos mensuales, y hacerse miembro es completamente gratis. Usted puede hacerse miembro de NYC Care siempre que haya vivido en la ciudad de Nueva York durante más de 6 meses, no pueda pagar y no califique por un seguro médico en el estado de Nueva York. Una vez que se haga miembro, recibirá una tarjeta de membresía que le permitirá visitar nuestros hospitales y centros de salud en los vecindarios de toda la ciudad. También obtendrá su propio médico, con quien podrá tener una consulta en 2 semanas o menos. Además, usted puede obtener medicamentos a bajo costo, con horario extendido en farmacias durante noches y fines de semana. NYC Care también brinda servicios especializados como salud de la mujer, salud mental, cuidados para la diabetes y exámenes de detección del cáncer. Si no está seguro acerca de los servicios que ofrecemos, tenemos una línea de atención al cliente disponible las 24 horas con representantes que hablan su idioma. ¿Está listo para reclamar su derecho a la atención médica con dignidad y respeto? Visite nuestro sitio web o llámenos para inscribirse hoy.
All right. Hello, New York City. It's great to see you all. Glad you can join us. That was, as you saw, a brief summary of what's we call New York City Care, NYC Care. It is a healthcare access program aimed at ensuring that the 8.6 million New Yorkers, including those who don't have access to healthcare insurance, have access. And so this program came about a couple of years ago. And we thought it was important to take a moment just to explain what the program is and how to apply. I'm Nick Smith. I serve as First Deputy Public Advocate in the Office of Public Advocate Jiménez Williams. And to introduce NYC Care, we have a really fantastic guest who I'm happy to that you're going to hear from, Dr. Jonathan Jiménez, who I'll bring on to the stage now, who can introduce himself and talk about NYC Care. Doctor, thank you so much, first of all, for your work. We know you are a family physician alongside Executive Director of NYC Care. So welcome to the stage, and the microphone is yours for your introduction.
Of course. Thank you, Nick, for having me. And thank you. This is very exciting to have this platform to share the good news about NYC Care. And as you said, I'm a primary care doctor, family doctor, and also executive director of the NYC Care program. And NYC Care really came about because we recognized that there were many people that were still uninsured and didn't know that they could access care through New York City Health and Hospitals, which is our awesome public hospital system here in New York City, the largest in the country. We have over 11 hospitals and over 36 different clinics. And through that, we wanted to create a single program, a single card that people who are uninsured and couldn't get access to health insurance could rely on to access not just emergency services and hospital services, but also primary care, preventative care, specialty care in the clinic setting. So really excited to share more and talk more about the program with you all.
Thank you, Dr. Jimenez, and we really appreciate you taking time out to join us. And we know you have a very busy schedule. What we're going to do, first of all, is again talk about why we're doing this. We know we're in a very highly charged political environment where folks are making very, kind of nasty comments about New Yorkers and including new New Yorkers. And our philosophy is we don't really, have time for that. We have New Yorkers, both longtime New Yorkers and new New Yorkers, who very simply need health insurance, and if they can't get it, access to healthcare, which NYC Care is. So we're thrilled to have this conversation to go through what the program is and how to apply. And so what we'll do is we're going to go through some questions so we can explain beyond the video you saw in Dr. Jimenez's introduction how to apply and get access to a healthcare. So Dr. Jimenez, let's go to the first question. So the U.S. has made attempts in the past to achieve universal healthcare insurance or universal coverage for all. I think most folks recall the very long debate about so-called Obamacare or the Affordable Care Act. More largely, there's been, I think, a 50, 60-year fight. And then we know Affordable Care Act did expand Americans' access to insurance, but with some problems. And I'm aware that there's actually a few million still uncovered, even after passing the Affordable Care Act. So can you give some background about health coverage in the U.S. and why it's important to have coverage? And what are some examples that we need coverage for?
Oh, absolutely. Yeah, health insurance started, about 100 years ago in this country, really trying to protect people from financial catastrophe should they get sick. And we've developed a system over many decades that is really based on employer-based insurance. And of course, we had the expansion to folks who are over 65 with Medicare and low-income people with Medicaid. But there were still many people who were still uninsured. And so Obamacare expanded eligibility for Medicaid so that even more people could qualify and set a lot of really important rules to make sure that everyone had comprehensive care through health insurance. But, there are still some big gaps. So even though New York State, in 2010, there was about 10% of New Yorkers were uninsured. And now we're around 5% uninsured because of the benefits of Obamacare. There's still that 5% overall, looking at the overall population. And among undocumented immigrants in particular, 45% of people are uninsured. And so there's still a large group of people, many of who've been here for over a decade, who don't have access to health insurance and therefore health care. And to your point about why is it important to even have health insurance, the reason is that health insurance protects us from the costs of seeing a doctor when we have symptoms, when we have a question, something that we want to address in our health. And, the evidence shows that we're not very good at trying to make those decisions based on costs. So we have to rely on our healthcare system, our primary care doctors, to really help us make informed decisions about that and connect us to preventative services, screen for diabetes, screen for hypertension. As we age, also start screening for many different cancers, colon cancer, breast cancer, prostate cancer for some, lung cancer as well. These are all important, really important preventative services that everyone should have access to. And it shouldn't be that you have to get very sick and end up in an emergency room before you get the access to the care you need. And really, that's where NYC Care came in.
That's right. So thank you for that, Dr. Jimenez. And, I think this is a huge boon for the city. And frankly, the folks who developed it deserve immense credit for, putting this together. And in fact, can you talk a little bit more about how it came to be in the first place?
Absolutely. So recognizing that there were many hundreds of thousands of people, we estimate, in New York City who were still uninsured and not connected to primary care and preventative care, we said, let's create a single program that can connect people to New York City health and hospitals to connect them to primary care and make them feel that they have a right to healthcare, as we do in New York City. And so we created the NYC Care program, launched in 2019. By the end of 2020, we were citywide across all boroughs. And what the program connects you to is one, primary care, your own primary care doctor. We also send you a membership card with your name on it and the name of your primary care provider. And on the back, you also have fees that you would expect to pay with different services. And that's really important because one of the reasons that people don't access care, was alluded to previously, is that we're afraid of the medical bills, right? But if you know that you have affordable prices, our fee scale starts at $0 for a primary care visit, $2 for a prescription. Depending on your household income, there's a graded way that goes up. But you know what to expect to pay when you go to the doctor and when you seek the medical care, affordable medical care you need. So you also get access to pharmacy service, both through our facilities, but on a 24/7 basis also at CVSs that we partner with throughout the city. And of course, access to all of the different services that New York City Health and Hospitals has to offer, which includes cardiology, ophthalmology, gynecology, obstetrics, you name it. We have it across the city.
Fantastic. Glad to hear it. So that's actually a pretty good segue, Dr. Jiménez, into eligibility. So I'm sure folks who are watching or are going to see this video may say, look, this healthcare thing is a mess. I've gotten medical bills, getting transported to the hospital if some catastrophic thing happens, or, I haven't gone for a while because I'm scared of the bills. So talk a little bit about eligibility for NYC Care and how you can access it.
So to be eligible for NYC Care, you have to live in New York City. We started out with a 6-month residency requirement, which was highlighted in the video. We removed that, recognizing that people need healthcare as soon as they decide to live in New York City, right? You're a New Yorker from day one. Diabetes certainly isn't discriminating based on how long you've lived here. So we want to make sure you're connected to care immediately. That's number one. And then number two, you have to be excluded from health insurance, whether it's because you're not eligible for health insurance, often due to your immigration status, or the insurance that you are eligible for is unaffordable to you based on federal income guidelines. So we take a close look at your household income and make sure we screen you for health insurance so that if you are eligible for health insurance, we help you enroll in that because we want you to have health insurance if you can. But if not, then there's always NYC Care, and there's always a right to health care and preventative and primary care services backing you up.
Yeah, and I'm trying to, think of, okay, that sounds good, Dr. Jiménez. How do that all sounds good. I can't afford insurance, or, my employer gives me inadequate insurance, which is a thing. So what's kind of the process for applying? Is there an online app? And if not, are there certain ways to apply that makes it easy, simple? And when do you need to apply?
We don't have an online application at the moment, but we do have one 24-hour NYC Care call center, which is at 646 NYC Care, 646-692-2273. And we have agents standing by 24 hours a day to answer your questions about the program, to help you facilitate and start that enrollment process, which is, as I said, includes screening for health insurance, and then enrolling you in the program. And in fact, that's the same contact center that once you enroll, you can use that number to request prescriptions, schedule a primary care appointment, and stay connected to your healthcare overall over the time that you remain a member of NYC Care. So that's one of the major ways. We also, from the beginning, recognize that many people, are afraid to seek the services and benefits they need. And so we partner with community-based organizations across the city. From starting in 2019 to now, we partner with 22 organizations across the city. They're posted on our website, nyccare.nyc. So if that's more comfortable, if one of those organizations is well known to you in the community, you can approach one of those organizations. Their staff will well educated and know about the program, and can guide you through the enrollment process even. And then lastly, of course, there's our facilities, which have our excellent staff, front desk staff, and financial counseling staff that help you get screened for health insurance and enroll you in NYC Care should you be eligible.
Awesome. And another kind of subtopic I often think of, in fact, dealing with it in the public advocate's office, is language access. And so, I went to your website and saw some really fantastic videos, by the way, that summarizes NYC Care and its benefits and how to apply. But in terms of folks who may have some concern about applying, can you address those fears? Maybe folks are new New Yorkers or folks who may have some concern about applying for a government so-called program.
Absolutely. I am a child of immigrants who only spoke Spanish, so I did a lot of translating for my parents, and I think, unfortunately, that burden shouldn't fall to our patients' children. So we have telephonic interpretation available at every single point of contact, with over 300 different languages available. We also strive to have staff that are bilingual, that speak all the different languages that our New Yorkers speak, and you shouldn't be surprised that they do, because our staff are New Yorkers who often live in the city. And those are really one of the major things. We're continuing to strive for language access. We just translated our NYC Care flyers into 50 different languages to make sure that everyone can access the program and that language not be a barrier.
Yeah, very well said. Thank you for that. We deal with, you mentioned 50 different languages, same in our office. And, a couple of populations, just to touch on them, even among new New Yorkers, are those, frankly, from a few West African countries who may have just arrived, or folks from Central or South America who are just arrived. And of course, longtime New Yorkers who, I saw some of the stats about the Bronx when this came out a couple of years ago, and it showed that I think some 10,000 Bronx residents gained access to coverage based on NYC Care, which is a fantastic statistic. And so I would say for, people who are critical of government, and that's understandable. I've been critical of government myself on some things, but this is an example of where government can step in to cover a huge gap or a problem that we've seen basically generations. I personally have had my own issues with healthcare insurance coverage, and my family members. And I'm a father of twins. They go to the doctor, it seems like once every 3 weeks. As a family. So it's very important to have coverage. And I see some comment in the chat here. Ms. Hollingworth says a lot of my participants are undocumented. And I see a note that New Yorkers can apply for NYC Care regardless of immigration status. We also put the phone number in the chat. So if anyone has questions, feel free to drop them. But before we wrap and show the website, Dr. Jiménez, any other sort of things we should know about the program itself, or things you just want to say?
Well, to your point, I think, the results, I think, have spoken for themselves in many ways. And so I do want to highlight that we have over 125,000 members across the city now. And that really speaks to the way that the program has served so many people. We know many stories of people that haven't seen a doctor in decades. And for the first time, because of this program, because of you, people in the audience spreading the word, our community-based organizations every day spreading the word about the program, find out that they can actually access high-quality care that's affordable. And it's really that mission that keeps us moving forward here at New York City Health and Hospitals. And so really glad that you had us here on the show today to share the information, because as you know, there are many new arrivals that are just getting to know New York City, and we want them to know that NYC Care and New York City Health and Hospitals is here to serve them, no matter their immigration status or ability to pay. Absolutely.
So thank you. So again, Stacey followed up saying, are they eligible? I think that kind of touches it. Definitely put the application in. Have no fear about any sort of concerns, and the NYC Care will look at the applicants and make a determination. Does that make sense? Awesome. And I see our colleague Teresa Doherty says NYC Care leadership and our CBO partners make presentations and conduct NYC Care outreach at events across the city. If you'd like to invite NYC Care to speak or table at your event, I think there's a form. I think Teresa, the comment was cut off, but just send it to us and we'll make sure we get it up. This has been great. Really fantastic. So thank you
thank you for having me.
Absolutely. So thank you, Doctor. What we'll do now, I'm going to click over to show folks the NYC Care website. And if you have any further questions, just drop them in the chat and we'll go from there. But Dr. Jiménez, keep on doing the good things, man. New Yorkers need you in the service. We thank you for your work.
Thank you. Thank you for having us.
Awesome. Awesome. All right. So what I'll do now, I'm going to, if I can do this, share my screen and show the NYC Care website. So if you just give me a second, here we go. All right, cool. So here's the NYC Care website. As you can see, it's www.nyccare.nyc, or to apply, you can call 646 NYC Care. And this site gives you more information, as Dr. Jiménez was explaining, about how to apply. And you have to call or visit a center. In fact, I'll click on the enrollment page, which will show you, as Dr. Jiménez was explaining, ways to enroll. And here you are. So it says here, meet with a counselor, call a rep at that phone number, or go to a community-based partner, as Dr. Jiménez mentioned. But the easiest thing may be just to go ahead and call that number. So it's 646-692-2273 or 646 NYC Care, and get the information you need. Of course, you will need some documentation, as we mentioned, to enroll. And I'll just skip down to those categories. It says, will I need to provide documents? Absolutely. And if you drop down to the document category, you'll see proof of identity, income, address, and eligibility information. And of course, under identity, there's a bunch of options: driver's license, ID NYC, passport, a foreign ID, green card, work permit, a naturalization certificate, visa, school ID, a marriage certificate, birth certificate, EBT or CBIC card. So that's pretty expansive. Income, you see the items there. So we're happy to share this information. Please do share this info with anyone you know who doesn't have insurance. As Dr. Jiménez said, they will either refer you to opportunities to get insurance, either your employer or other opportunity, maybe Obamacare, the exchanges, or access through NYC Care. So with that, we thank you all for tuning in. We thank Dr. Jiménez and Alex from NYC Care, and Teresa Doherty, who I've known for quite a long time, for sharing this info. And lastly, you can reach us on social media at NYC Public Advocate. We thank you all for tuning in. We'll be doing this once every few weeks to show what's out there and how to get access, and then we'll see you all soon. Thank you very much.